This rendered all IPC guidance null and void. Unfortunately, the IPC cell has turned out to be a law unto themselves. In creating guidance for a new threat, as was the IPC cell's job, it's important to impose that precautionary principle failsafe early on. He said guidelines should have stayed in place until scientific evidence proved credibly there was no aerosol transmission. Dr. Jones told of an incident that proved pivotal in our collective fate. Deputy Chief Medical Officer Dr. Jonathan Van Tam emailed that COVID was airborne until proven otherwise. And there was no evidence for the droplet route, remember. But health and safety legal procedures were abandoned for prevention and control. Dr. Jones said the IPC specialists who dictated guidance made statements not based on evidence. You could even call them dishonest statements. They didn't apply the precautionary principle in the face of scientific uncertainty. They didn't even include natural aerosol generators in the official aerosol generating procedures, or AGPs, such as coughing, sneezing, and even breathing. They even ignored advice on the 14th of April from SAGE's environmental modelling group that the pandemic was likely transmitted by aerosols. And this is where it gets really weird. Public Health England is essentially one of the IPC cell's bosses. They have the authority. They asked several times over 2020 and 2021 for widened use of respiratory protection, but were ignored. Dr. Jones noted that the guidance authors demanded very high-level definitive evidence to prove the airborne route was dominant, while having no evidence whatsoever to justify the droplet one then or since. He said, "It's not scientific, it's a reflection of the culture. Aerosols should have been protected against from the outset." Worryingly, not only the IPC cell, but also the WHO initially categorised SARS-CoV-2 as airborne, and then contradicted itself on Twitter and across social media, saying that COVID is not airborne, it's droplets and surgical masks are fine. Their claim that they were following the science is untrue. Neither did they offer any scientific evidence. The precautionary principle was removed from IPC guidance in mid-March 2020 without evidence, at the same time as HSID declassification.